Hello, we're going to be talking about the biopsychoeducational model. This was prepared by Elizabeth Gates, Stacey Leffler, and Mary Pitre, SPED 5050 for summer 2021. Introduction. The biopsychoeducational model, or BPE, promotes a comprehensive problem-solving process within a school setting for the purpose of supporting children affected by health issues. What is the biopsychoeducational model? It is an approach to education that ensures that all factors are considered in the child's ecology via a systematic, collaborative problem-solving process to better understand the child's difficulties, to prioritize concerns, to design appropriate strategies, and to evaluate regularly to prevent continuous problems due to the child's health issues. The model provides structure to guide professionals, particularly school psychologists. Why was the biopsychoeducational model developed? To create a structured approach for working with children who have health issues that affect their educational process, to improve a child's health, to foster the child's development through collaboration with the family, educational setting, and medical system, to aid in the often complex assessment of strengths and weaknesses of children with health issues, to help design and evaluate effective interventions for children with health issues. How is the biopsychoeducational model used? First of all, the main target of this is to create protocols for all children with major illnesses to transition back to a school setting. It also helps with interventions to individualize specific interventions for each child if problems arise upon returning to school. The biopsychoeducational model effectiveness. The biopsychoeducational model can only be effective when all ecological factors, including the child, family, educational setting, medical situation, and other community factors, are taken into consideration. And you can see in this diagram here that all four of those circles need to collaborate to be an effective model. A scenario example. So here's an example of when you would use the BPE model. A 5th grade student is returning to school after chemotherapy treatment for cancer. The student has missed several weeks of school and may experience some significant side effects of the treatment and the cancer. So what would happen if we were using this model? A meeting would be scheduled either in person or virtually with the oncologist, pediatrician, school psychologist, counselors, educator, and parents. A sound understanding of all of the relevant systems, the family, the medical, the education, and information about the child is essential to comprehend the complexities that exist for the child. And then protocols would be created to successfully help the child transition back into the school setting. So some of them could have been, only coming back half a day or whatever until that student feels strong enough. And effective classroom interventions would be also determined. Maybe there needs to be a tutor to help catch up to where they would be with the rest of their classmates. Okay, so here's some strengths of the BPE model. School psychologists and medical professionals develop a partnership. They jointly plan interventions. Jointly planned interventions are created that best serve the child in the educational setting. It has a strong foundation in communication and collaborative problem solving. Teachers, peers, parents, and medical personnel will be educated about the characteristics of the chronic medical conditions and pediatric health issues during the collaborative problem solving, which will ultimately help those individuals help all individuals appreciate the impact of the chronic illness on children in order to intervene early and promote their success in school. So it basically gives a great awareness for everybody about what's going on with that child and what's going on in school and at home and with the medical condition. So everybody's on the same page looking for the best interest of that child. Some of the potential drawbacks is that the school psychologist may lack the training and experience with specific health issues because lots of different things are going to arise that they might not have ever been exposed to before. Communication between school personnel and the medical community is often challenging, and there could be a lack of understanding a lack of time and availability of school personnel and the pediatrician. And these are our references and our credits. Thank you for listening to our presentation.